1995, after going through the 10-day program in St. Helena, I came back. I was stoked. For the next several years, I was running marathons, getting into super shape, felt fabulous. I stayed on the program for about 5 years until the late 90s, and then I kind of lost focus. I went through a divorce. I got involved in some things that were not good for me. And I just kind of spun off on my own for a couple of years and gained 250 pounds. I started not feeling well for the first time. I lost energy. And then finally in 2006, I had a severe angina attack one morning. At that time, I weighed 440 pounds. I managed to convince myself that it was just indigestion. It lasted about an hour. I went about my day, and then later in the day I had a second attack, which was even stronger. And at that point I went to a doctor. Doctor did an EKG and said that there was no evidence that I was having a heart attack, but my cholesterol was up around 300. My blood pressure was up in the 150s, 160s. My weight was over 400 pounds. I was out of breath walking upstairs, and I was having angina. He wanted me to have an immediate angiogram and start me on drugs. I was very familiar with the McDougall program with respect to heart disease. I've read all his books, and I turned them down. I told him that I wouldn't do that test and I wouldn't take the drugs, but that I would go back on my McDougall program and eliminate animal products and cholesterol and go back to my walking and running. Back in the late 90s, when I was running marathons, I came second in the San Francisco Marathon for my age group. I knew I could do it again. McDougall had shown me once, and even though I'd lost focus, I'd never forgotten how good I felt 10 years earlier. And so that's what I did. I started back on that 2 years ago. Have gone from 440 pounds to just slightly over 200 pounds. My cholesterol last check was 115. I did permit them to put me on the standard drugs that everyone gets, but I have weaned myself off them. Meeting with Dr. McDougall several times, he helped me as to which ones to begin to drop. And now I'm down to no angina attacks. I run, I walk. I'm 68 years old. I have excellent health. Once I take off about another 30, 40 pounds, I think I'll have reached the best I could do. I love the program. I've had less than a thimbleful of cholesterol in the last 2 years, plus very little vegetable oil. My doctor says that I'm the only patient he's ever had who had those symptoms who didn't have a stent or a bypass. And he's amazed, and he's kind of, now after 2 years have passed, he said to me that he's moved from being scared about my condition to rooting for me, and feels that I'm one of the rare cases that I guess he thinks this is probably okay. But I don't feel I'm one of the rare cases. I think Dr. McDougall convinced me that this was obviously the way to go, so long as I didn't have severe chest pain, which I didn't, ongoing. And I love it. I didn't find it hard to do the first time. It was just I became disinterested in it at that time, and was going through personal issues in my life, and went back to eating ice cream and potato chips because that was the food that made me feel good. But not anymore. When I'm stressed now, I get pineapple, or eat an apple, or go take a walk or a run. I love it. I'll never be that way again, and I've lost about 2 pounds a week for the last 2 years. And continuing on that is what my intent to do is. And I love the program. I love the food. Well, in the early stages, people were afraid that I was going to die from lack of protein, lack of vitamins. But they saw me getting better and better and better. Then when I had the chest pains and wouldn't go for the stent or the angiogram, the stent and the bypass, they held out little hope for me. They felt that I would probably never see next year. But I'm here, I'm healthy, I feel great, and you'd have to shoot me to get me off the program. I'll never go back. Well, I know that a lot of people think that this is such a rigid program, that to move from pizza and ice cream and cheeseburgers to fruit and vegetables and salad and pasta is like an impossible thing to do. And I did too, and I've done it twice. After about 3 months, it becomes so natural that the other foods, the old foods, don't even appeal to me anymore. If someone put down a pizza or ice cream or cake and swore to me that they had made a deal with the devil that I could have this without any side effects, I'd say I'm not interested.